I'm Rose Hayden with Hunt Regional Healthcare, and I'm with Sara Boren, a doctor of physical therapy with Hunt Regional Medical Center, and we're talking about vestibular therapy today. Sara, thank you for joining me.
Thank you so much for having me.
Yeah, absolutely. So let's kind of jump right in. What is the vestibular system?
The vestibular system is how we feel our overall sense of balance as well as our position in movement in order to help keep us safe. But the components of balance that really comprise of helping us be safe is our vision, our vestibular system, which is located in our inner ear, as well as our proprioceptive input, which is where we feel our feet are in relation to the ground.
Very interesting. Now, if someone was having issues, what symptoms would they have?
The most common one you maybe have heard of is vertigo, where you feel like the world is spinning around you when it really isn't. But there are other ones that you can feel, like blurry vision with head movement, like walking down the street and feeling like everything is double vision, or even just not feeling safe when you walk and all of a sudden feeling like you're falling more or just about to fall.
Okay. Now, what are the causes then of these symptoms?
There are many different things that can cause these symptoms, but the most common one that people have heard of is BPPV, which stands for benign paroxysmal positional vertigo, which this can occur when our vestibular system is impacted by the otoliths, which are crystals that sit in our ear. Funny word,
all right,
but they end up in the wrong spot in our ear. But it also can be impacted by concussion, or even a headache can impact our vestibular system.
Okay, now what treatments are available?
So in terms of physical therapy, we can come in, or a patient can come in and do an individualized we will do an individualized evaluation on these patients, where we come up with a plan of care, goals that we need to address in order to decrease their dizziness, improve their activity tolerance, and just overall safety out in the community.
Now, how long does treatment take then?
It depends. So it could be 1 to 2 visits and you see significant improvement in terms of your overall safety. Sometimes it takes 1 to 2 months. It just depends on all the things that we are trying to address.
Okay, that's not very long. Now, what special training then did you have to be able to do vestibular therapy?
I was fortunate enough to go to a class put on by the American Institute of Balance that I was able to get a certification in vestibular rehabilitation as well as concussion. So I just feel blessed that I was able to get further equipped to treat the patients that I encounter.
Excellent, excellent. And if someone wanted to learn more information about this, they thought that maybe themselves or someone they knew had these issues, how would they get a hold of you or to ask more questions?
Exactly, glad you asked, but you can go to our phone number or call our phone number at 903-408-1886. Again, that's 903-408-1886. Or you can go to our website at huntregional.org and you can get the information that you need there. And really just key to remember that we treat anyone on the spectrum that has any issues with balance at all, where they feel unsafe or unsteady on their feet. Don't wait for the fall to happen or for it to get worse. Please don't hesitate to come in and a physical therapist would be happy to work with you.
Wonderful. Thank you for the advice. Appreciate it. Thank you for your time. I learned a lot.
No problem.
This video has been brought to you by Juice 34. Juice is your community-owned provider for electric, internet, cable TV, and true local programming.